Lawmaker says he has not received any apology from a Nairobi-based lab even after his late mother was confirmed negative of COVID-19 despite the lab's first diagnosis. The Member of Parliament is now demanding answers on the accuracy of the COVID-19 testing labs in the country. This even as Kenya inches closer to the 7,000 mark of COVID-19 infections after 168 more people tested positive for the virus in the last 24 hours. Zainab Mohammed reports.
Kiambu Town Member of Parliament Jude Jomo is demanding an official apology from a renowned lab in Nairobi after it provided what he says was a false positive result to his late mother, leading to a hastened burial following the government-set guidelines on the burial of a COVID-19 patient.
Well, I have not received any apology from anybody apart from yesterday when we were in the meeting, and it was made clear by the chair of the health committee that the hospital owed us an apology, that the CEO actually owned up and agreed to apologize to me on behalf of the family.
The aggrieved MP now says there is need for emphasizing on the accuracy of COVID-19 tests due to the overburdening consequences that follows a false positive result.
So I wanted the National Assembly Committee to investigate so that we ensure that no other Kenyan will ever suffer because of misdiagnosis by a laboratory. We want to make sure that the results that are announced on a daily basis by the Ministry of Health are accurate results, are results that are factual and not anything fabricated.
This even as the ministry says there is a possibility of errors in the testing process due to a number of unavoidable circumstances.
There are very many things that one needs to look at. When you see a test failing, is it because of the way the sample was transported? Is it because of how that sample, when it was in the lab, was processed? Because once the sample comes to the lab, it has to be processed. You could lose that RNA in the processing. Is it because how long has the sample been around? I think we talked about that. The longer you keep a sample, its viability goes down and your chances of being able to pick up that nucleic acid also goes down. Then, of course, there are system errors.
On the current status of COVID-19 in the country,
today we report 268 people who have tested positive over the last 24 hours after testing 2,704 samples. This number brings our caseload of those confirmed positive to 6,941 out of 1,766 and 1,766,059 cumulative samples so far tested.
20 patients have been discharged from various hospitals in the country as 3 more people succumbed to the virus. For TV47, I'm Zainab Mohammed.